exam?
Excuse me?
Are you gonna are you guys, do you guys throw like questions off after you get together as the teachers, or like see which ones we miss the most of or anything?
What we do is we go through and we look at the questions and we see if there's any questions that many students missed that could have been misread or put in. I can see maybe 2 questions, maybe this exam. That's about it. Okay. We are very fair. We go through, I go through all the numbers from all of the grades, all of the questions to make sure that it is a fair exam. Okay. You've seen the grades change throughout exam 1 and exam 2, same thing.
Okay, because I was just asking, because for exam 2, like I didn't get any feedback, so I didn't know.
Which means that those questions we threw out, you already had right. Which could be, it happens that way. All right, let's go ahead. We do have a 70 question cahoots. It is, it's gonna get a little bit longer than 5 o'clock. If you have to leave, you have to leave, okay? But let's see what we can do for that. I am gonna go and I'm gonna finish it. So please hang with me and keep playing the game so I can be excited when somebody wins. Right, Jillian? Yeah, Jillian loves to win. All right, let's get going. HESI review 2022. What is probably the single most important influence on growth at all stages of development? If you don't know this one, by the end of my course, you haven't learned anything. Nutrition, 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 right? Good job. Frequent developmental assessments are important for which reason? I mean, that's why we learn fine motor skills and gross motor skills and when they should get them. And remember, when we identify this, it's that we can identify those delays or deficit, we will institute early intervention. The earlier we can institute physical, speech, occupational therapy, children catch up very, very quickly. The head to tail direction of growth is referred to as what? It's another name for it. Remember, we start with being able to pick the head up and then rolling over. So cephalic, head to toe, caudal. What is the single most important factor to consider when communicating with children? Now, children are very particular, and if you don't get on their level and explain things well, they're going to run in the opposite direction, and you're going to basically take more time trying to do what you need to do for that child. Get on their level, have fun, play. What 2-year-old pain assessment tool should the nurse use? 2 years old, what is that pain scale? When we talk 2-year-old, it is FLAC. It is FACES when you get to preschool, age 3. I put this question, I think this is the 3rd time I've put it on a Cahoots. Very important question, okay? It's that break off time. They still can't express it yet. What is priority treatment for a child with dehydration due to profuse vomiting? They're vomiting. How do we correct dehydration? Because remember, dehydration is extremely serious when you're talking about children. And IV fluids, if they're vomiting, they can't drink. And we need to get fluid in quick. IV fluids, give them a bolus. And remember, it's a bolus without dextrose. The first expected fine motor developmental milestone for an infant begins with, remember F, fingers. F is fingers. G for gross is get up and go, go, go. So it is a reflex. That's when mom puts the finger in their hand, the infant hugs it, but it's a reflex. They go, oh, my baby's hugged me. I'll never tell a parent it's a reflex, never. An 8-month-old infant should be expected to perform which fine motor skills? Remember, F, fingers. So by the age of 8 months old, they should be able to take the rattle, put from hand to hand. They should also be able to that pincer grasp, but it's more crude. They'll take their fingers and swoosh like Cheerios in their face. That's why we call it crude. It's not so fine. In general, an infant should triple their birth weight. When? How many months? We should double at 6 months, triple at 1 year, 12 months of age. RN is assessing a 2.5-year-old toddler should report which finding to the provider. Something's not right. Which one of these is not right? So the head at birth is huge and it's bigger than the chest. By about 2 years old, they should be the same or the chest should be bigger. If the head's bigger, something's wrong. Hydrocephalus, brain tumor, something. A 2-month-old infant has cradle cap. What should the nurse tell the parents to do to treat it? So we need to wash the hair still with soap, but a fine brush and just brush it. Some books say mineral oils, just soap and water is fine, but it's that fine brush. And just continue to do that every day and all that crust will disappear. According to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning should understand what? Kohlberg, preschooler, ages 3 to 5. So they understand good and bad, and they understand good gets some sort of consequence, but so does bad. My little grandson knows if he does something bad, should I do it? Is it worth that? He cracks me up. Which nursing action is appropriate to teach a preschool age child about a scheduled procedure? How are you going to teach a preschooler? Age is 3 to 5. Because if we teach him with a doll, let him touch it, feel it, equipment, all of those things, you are going to have an easier procedure and the child will behave during it because he knows what's going to happen. Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? Toddler, ages 1 to 3. Let them touch, feel, play, let them push the buttons, let them do you first, whatever it takes, and then you're going to get some accurate readings. In terms of language and cognitive development, a 4-year-old should be expected to do what? This is that preschool age. You should be able to tell them to put their shoes in wherever it's supposed to go, laundry in the dirty hamper, dishes in the sink. They should be able to follow those simple commands. Parents are concerned that our 8-month-old child is not developing like the older child. So what is normal for 8 months? They should be able to sit alone, unsupported, no pillows, not holding. They will maintain their body at 8 months old. A multi-select. Which would alert the nurse to hold digoxin on an infant she's caring for? So it doesn't matter if it's digoxin on an adult or a child. The only difference is the heart rate. Heart rate of 90 is too young for an infant. The lowest I would accept is 100. And then dig levels, it's the same level as adults. And potassium must be normal. And one of the clues that you'll see is vomiting. An infant vomiting on digoxin, I'm going to hold that digoxin, get a level. A 4-year-old is reluctant to take medications. What intervention should the nurse take? You have a preschooler. Yeah, I don't want that. And then one thing I'll tell you, never, never, never mix medicines with food. What if they don't take the whole thing? How much did they take? So do not do that unless it's like a little tiny little piece with a spoon and they take the whole thing. If you do a straightforward approach, I have a pill that you can chew or liquid. Which one do you want? Do you want a cup? Do you want a syringe? Straightforward, to the point, and then they can't, say no. I know they're going to try. Which concept reinforces the development of sense of trust for an infant? Now, Erickson is going to be all over your HESI. You need to study Erickson. I believe there's 4 questions. So when you talk about trust and you talk about infant, the infant knows what is coming. They know they cry, they're going to get fed, they're going to be changed, they'll be burped, they'll go to sleep, whatever they need, they're going to get. That is trust for an infant. An infant is NPO, unable to take breast or bottle for feeds. And what is important to remember? Their condition means they can't eat. Like, let's say it is an esophageal atresia. Let's say they can't, if they eat, where's it going to go? It's going to come back out. Or a tracheal esophageal atresia. You don't feed these children. So we're going to give them a pacifier. They still need that for their development. They still need to suck, and it helps relieve stress. When teaching sex education and contraceptive for adolescents, what should the nurse consider? And you can teach, adolescents. What you need to give them is just talk to them and give them written information and never put your opinions there. And we could say you shouldn't, but what are adolescents going to do? They're going to do what they want. So teach them how to be safe. The monthly immunization for RSV, and it's not every month, it is from fall to early spring. And we use those for those immunosuppressed children, premature children. And it's called Synagist, and the other name is palivizumab. And this helps prevent getting RSV, because RSV is a bunch of mucus, and some children can't handle more mucus in the airway. An infant with a hypoplastic heart is becoming tachypnic, taking a long time to eat, requires rest. What assessment is priority? What do you think is happening? Tachypnic, tiring easily. What could that be? is probably going into failure. Hypoplastic left heart, cyanotic heart disease, and this is telling me probably fluid is building up. Listen to the lungs, see if you hear it. When doing an admission on an infant with a low-grade fever and a loose cough, what information is priority for placement? You know, this child's being admitted into your unit. You need to place them in a room that is okay for the other kid too. Which one here is telling me what placement is safe for the child and the other child? And that's immunization status, okay? So if the child's not been immunized and they have this low-grade fever, loose cough, we don't know what it is. So that child must be put in a room alone. Safety for both children, that child and all the other children on the unit. So a 3-year-old's brought into the ER with increased wheezing for the last 2 days. The child is using an MDI. What information is most important to ask? So did we use a spacer, or was that MDI just squirting in the air so they're not getting their rescue medication? Very important question, because maybe just giving the MDI properly is, will help that child, feel better. A multi-select. What is included in the plan of care for a child with cystic fibrosis? You're talking about mucus in the lungs. We're talking about issues with digesting foods, losing fat, terrible stools that are terrible smell. And we're losing all of our fat vitamins, right? So to prevent muscle wasting, we need a high protein diet. We are going to take care of that chest by what aggressive chest physiotherapy is. We're going to do CPT and aerosols and deep breathing and coughing and using that incentive spirometry. Keep those lungs open. And of course, pancreatic enzymes, because we need that for digesting food immediately before they eat meals. Which information is most important when rheumatic fever is suspected? Rheumatic fever can go to the point where they're having chorea. They'll have the fever and all those things, but they'll have that shuffling gait. And parents are very concerned about it. Is it permanent? No. Chorea can be corrected in time by treating that strep throat. And once the strep throat is treated, this child is going to be walking normal again. Very important thing for parents to know. A multi-select. What are some assessments that an infant would have if they were in acute respiratory distress? An infant, how do they tell you? Well, I could say if the respiratory rate is really high, what's the normal respiratory rate? So we're going to have nasal flaring and we will hear that grunting. I hear a little infant and I, see the little nose going in and out because they breathe through their noses, not their mouths. They don't know how to change to their mouths when they need to. But you hear that little at the end of every breath. That child is just about to go into respiratory arrest. What is the purpose of giving indomethacin to a neonate with a patent ductus arteriosus? Indomethacin is actually an NSAID. Years ago, they used that for back pain. So PDAs are kept open by this hormone called prostaglandins. Sometimes it continues to secrete and keeps that duct open. It's fetal circulation. And it's basically moving oxygen back and forth to the body, and it creates more issues. So indomethacin blocks that prostaglandin and it closes. What is the greatest risk factor for a newborn receiving a cardiac catheterization? So the big thing is we've put these catheters into the femoral artery and vein, and they're big. And our biggest concern is hemorrhage. If we have hemorrhage, we see bleeding, we put our fingers right above that insertion site, like closer to the heart, and put pressure and then call for help. Making sure that we check that dressing is our #1 priority when they come back from the cardiac cath. A 10-month-old status post ventricular septal defect is getting morning meds. His vital signs are of such, what meds should the nurse question? Blood pressure 118/70, temp 99, heart rate is 88, respiratory rate is 22. What medication doesn't work with those numbers? And that is digoxin. 10-month-old should have a heart rate of at least 100. If it's not, we need to hold it and get a level. While assessing a newborn infant, you noticed decreased femoral pulses bilaterally. What action should the nurse take next? What could this be? Femoral pulses, they're decreased. And this could be a coarctation of the aorta. It's a kink in the aorta, and it goes down and it bifurcates and goes down both legs through the femoral arteries. If it is decreased, it's probably coarctation. Do a 4-extremity blood pressure. The lower extremities will be lower than the upper. How do you get an adolescent to open up about their sexual history? I think adolescents are the hardest of all children to be able to help because it's difficult for them to talk to you. So start to talk about their social life, music they like, clothes they like, anything to start them opening up and they'll feel relaxed. And, and give them that opportunity to be able to express themselves. A multi-select. When educating adolescents about risk for HIV and hepatitis, what would you include? So, I mean, we want to tell them abstinence, but we know that's not always going to happen. So at least using condoms will help. And of course, always hand washing. Weekly showers, well, I hope they bathe more than that. What stage of Erickson's would you use for a school-age child? And when you're studying these Erickson's, make sure you understand what these words mean. You're talking about infants and trust. What does trust mean for them? When you're talking school age, what is industry? It is what they do well versus inferiority. It's what they can't do well and they want to do well, okay? So understanding that, I'm telling you, it's on your HESI, be prepared. A multi-select. A child with hemophilia has fallen down, the knee is swollen and painful. The treatment would include what? Hemophilia. They're missing a factor. They're bleeding. That swollen is probably blood in the joint. And we don't want those joints to be full of blood so that they become to the point where they can't be put in a position where they can at least be in a wheelchair and get around. So we want to rice. The words are rice. We're going to elevate it. We're going to put ice on it, never putting hot packs on it because that will make more bleeding. It dilates them. And we're not going to exercise it. It's going to increase circulation, increase bleeding. So we're going to rest, ice, contain it, and elevate it. Think rice. And if we need to, home factor. Your child with ALL leukemia has recent lab results, and the platelet count is 10,000. Nursing action, what should you do for that child? So 10,000 platelets means you're going to bleed. You're going to see petechial sort of things. You're going to see maybe nose bleeds. You're going to see gums bleeding. Place them on bleeding precautions. Decrease those IM injections and monitor that child for it. Also monitor those CBCs, seeing where that platelet is daily. A child starts with a nosebleed for no reason. What should you do first? How do you treat epistaxis? And if that doesn't work, you need to get medical attention. And we'll apply pressure by pinching the nose for 10 minutes, leaning forward so they're not going to swallow blood. And if that doesn't work, as I said, get medical attention, something else is going on. An 8-year-old semi-conscious boy is brought into the ER. Blood sugar is greater than 600. His pH is 7.12. Potassium's elevated. What is your priority action? I mean, looking at those numbers, what's going on? Well, it's diabetic ketoacidosis. How do you treat DKA? Priority. We're going to give normal saline bolus, and we're going to start a slow, regular insulin drip to be able to monitor those blood sugars and to get them down. We don't treat the acidosis, we treat the blood sugar, and then the pH will come up. A child is admitted with hypoparathyroidism. What findings would you see that need to be reported to the healthcare provider? Well, what does the parathyroid gland do? What does it regulate? And the parathyroid gland is all about calcium. Now, whenever you see calcium, magnesium, think of muscles. If you don't have enough, your muscles will be weak, okay? If you have too much, they're going to be in spasm, all right? Calcium, you worry about that muscle weakness. A child with Kussmaul respiration due to DKA, the respiratory rate is trying to compensate for which acid-base alteration? You will see 4 acid-base questions on your HESI. Please review these. Be understanding what's going on. So we know we are in metabolic acidosis. The respiratory rate gets slow and prolonged, so it goes into a respiratory alkalosis, trying to correct the acid. When talking with an adolescent regarding personal health concerns, which is most important? So the thing is, we need to, of course, open up the conversation, talking about social things or, music or, sports, whatever. But then give them that opportunity to be able to express their feelings open and honestly, because they can't with their parents. Many adolescents can't. So if you build up that trust, they'll be telling you things which can help them, in their treatment. We can help them better. What procedure is priority to keep the lungs of a child with cystic fibrosis open? You know that mucus is like sludge in there. So chest physical therapy, very good. In the school age conflict versus industry versus inferiority, what does industry mean? I told you what it was. It's mastering that task. So what's inferiority? It's those things they can't do well and they want to be good at it. Contraindication to administering the varicella vaccine to an adolescent. Doesn't matter who the child is or the adult is. Varicella vaccine is a live vaccine. What do we know about live vaccines? Well, if they're on corticosteroid medication. Another thing about live vaccines, what about a child who's undergoing chemotherapy and they are needing to take a live vaccine? Can they take it during their treatment? No. When can they? About 6 months after their treatment is ended, okay? Because that is something that you're going to see. That concept will be around. Early detection of a hearing impairment is critical. Which one is of primary importance? What do we know about hearing? It's all about speech. Can't hear, you're not going to be able to speak correctly. Good. In helping a child to adapt to a hospitalization experience, the best approach is what? Kid has to be in for an extended period of time. What you want to do is keep that same routine. When they know what's coming next, the child's going to have a better experience. And you as a nurse are going to be able to better care for them with less kid going crazy on you. When assessing vision on a child, the healthcare provider would use the Snelling chart at what distance? And what if they can't see letters at 20 feet? You're going to report it to the healthcare provider. There's something wrong with the vision, right? Absolutely. Referrals for cognitive impairment should occur when? Early intervention is key with this, so as soon as possible. Good. How would you help encourage a preschooler to be less apprehensive when taking their vital signs? Again, let them play with the stuff, let them touch it, let them push the buttons. They'll be happy. The nurse is discussing sexuality with the parents of an adolescent with cognitive impairment. What is important? Why do we do that? So they need a well-defined concrete code of sexual conduct because children, adolescents with cognitive impairment don't know right and wrong. They need to be taught so that nobody can abuse them and take advantage of them because there's sick people out there and they will. What acid-base imbalance might you see with a child that's having profuse diarrhea? We're going to see metabolic acidosis because diarrhea is getting rid of all the alkaline. It's all those enzymes for digestion are all alkalinic. So you're getting rid of it. Now vomiting, you're getting rid of acid. So it would be metabolic alkalosis. Multi-select. If an infant has not passed meconian stool in the first 24 to 36 hours, what would you assess for? Hirschsprung's disease, that big outpatching no nerve, maybe a little bit of ribbon stool, but not much. Cystic fibrosis for sure, and hypothyroidism. Sometimes they have no clue this is going to go on and they see no stool and they're able to catch it quick. I mean, if you don't have enough thyroid hormone, these children are going to be very delayed cognitively. So very important we start it as soon as we can. A child with sickle cell disease would most likely exhibit what sign? And it's pain. You know, sickle cell children do have pain. How do we treat? What's priority treatment? IV fluids. Let's dilate those vessels, let those sickles go through, and that will start alleviating the pain. And we also give pain medicine, but priority is fluids and maybe heat too. When teaching the child and family about celiac disease, which one of these food items is allowed? So that is rice. I mean, these children, wheat, rye, and barley, they can't have, and we need to choose what's good. I mean, an omelet with bacon and ham and a milkshake and fruit and a soda, beautiful. A 6-year-old goes to the ER complaining of abdominal pain, fever, and vomiting for the last day. What assessment is priority? What do you need to know about this child? And you need to know where that abdominal pain is. Is it the right lower quadrant? That's a surgical emergency, right? We need to get them there before that appendix busts. Doesn't matter when the vomiting started, the vitals, etc. Number one, we want to know where that pain is. A multi-select. Signs and symptom of hypertrophic pyloric stenosis. When you suspect a child with pyloric stenosis, or if they come into the doctor's office or emergency room with vomiting, what is your first question? Are they vomiting with a dribble, or is it projectile across the room? And then you take your little hand and you go up and you feel their little tummy right at the upper mid abdomen, and you really feel this little tiny thing, and it does feel like an olive. And their appetite, they're screaming to eat. It's not poor, they are hungry. And diarrhea, they're not eating, so they don't have anything there. A multi-select. A child with chronic kidney disease has osteodystrophy. What outcomes would you see? Well, what is osteodystrophy? It's part of these things that happen with children with chronic kidney disease. Also, they have low red blood cells and hemoglobin hematocrits. So osteodystrophy has to do with muscles and bones. So the bones are not growing correctly, so they'll be slow, so they'll be shorter. Also, it hurts. There'll be a lot of bone pain, and there'll be very low levels of vitamin D. You think of vitamin D, think of bones and joints and muscles, and you do need that to help. If the other thing is, we're going to be given erythropoietin to these children because of their low hemoglobin hematocrits due to low red blood cells. So you suspect an infant has cryptorchidism. How would you examine this infant? We are going to put them in a warm room because the cold room will suck the testicles up. We want them down to get an accurate exam. A multi-select. What teachings would you give parents on how a hypospadias is corrected? Doesn't matter, hypospadias, epispadias. That means that the urine's coming out the upper or lower part of the shaft of the penis, not the end. So these children cannot be circumcised. This is important in the Jewish faith, that they can't do it then, and the reason why. Then they take this little stent, this little tube, that's an opening so urine can come out of it. Our job is not to touch it, just to put it inside the diaper and monitor intake and output. Leave it there till the doctor pulls it. No flushing, no nothing. A multi-select. Children with nephrotic syndrome are often given albumin and Lasix for fluid overload. What outcome do you want? Remember, nephrotic syndrome is the kidneys say, protein, get out of here. Lose protein like crazy. So you're lacking protein in the vasculature. You have no protein, in the blood. Fluid goes out interstitially. You give albumin, It's protein. So you replace it. So you're pulling the fluid back out of interstitial. You give a diuretic and all of that urine starts to come out. When the urine comes out, the edema goes away, your blood pressure comes down, and you're going to see a large output coming on. A 2-year-old goes to the ER with inconsolable crying and abdominal pain. What finding would show that this is a medical emergency? What do you think it is? 2-year-old, inconsolable, abdominal pain, crying, legs, arms, the legs are going up and down. The abdomen is so tense. You open up the diaper, and if you see current jelly stools, you know that this is intussusception. Current jelly stools go with intussusception. When assessing a 2-month-old with vomiting, what question should you ask the parent? And it's basically the forcefulness of the vomiting. Does it dribble or is it projectile across the room? Because it could just be reflux, or it could be pyloric stenosis. You notice a 2-year-old child with congenital heart disease, the heart rate's decreasing. What other information is important to tell to the healthcare provider? Congenital heart disease, heart rate's going down, something's going on. That blood pressure is way too low on a 2-year-old child. So please review your vital signs for children. A multi-select. When entering the room of a child, the child becomes stiff, the arms and legs start shaking. Priority, what should you do? What do you think that is? Stiff and they're shaking. Probably foaming at the mouth too. Notify that response team. You're going to turn them to the side to protect that airway. You're going to protect that bed, remove things, sharp things, and flatten the bed so that they can have an open airway. And then, of course, monitor time duration of this seizure they're having. A 3-year-old with a waddling gait and falling is admitting for testing. What examination would you anticipate? 3-year-old boy waddling gait and falling, probably Duchenne muscular dystrophy. So they're going to be doing something to examine those muscles. We're going to do electromyography. Now, it hurts. So tell the parents they might come back and they might be really uncomfortable in the muscles, but it's only for a little while. It will go away, and give the child some ibuprofen or whatever is appropriate for the child. A mother calls the clinic about her child. She's been playing in the woods and now she has a rash that's spreading. What over the counter is good to give this kid? This rash spreading. Go to give something over the counter. When you hear rash spreading, you cannot recommend something. They need to get medical attention. It could be maybe poison ivy or something, but it could be a lot worse. So get them to medical attention to evaluate it. A mother calls the clinic. A friend of her child has ticks from playing in the field. What would you tell the mother to do? I mean, her friend has ticks. What are you going to do for her child? We're going to check that body for ticks because the friend has it. Possibility she has it too. And you try to get them out. If you can't, you need to get to the physician and he can help get them out. An adolescent goes to the school nurse complaining of ringing in her ears. What exam should you do first? You're going to look first. Let's see what's in there. Something might be going on in the ear, and then go further. Last question. And a multi-select. An infant's being discharged after 14 days of vancomycin. What teaching should be included for this parent? What do they need to do? What do they need to watch out for? What are the things with vancomycin? Long-term of that can cause hearing problems and kidney damage. So we're going to monitor their hearing and their urine output. Good. Here we go. Number 3. Sandra, good job, Sandra. You hung in with me. J baby. And number 1. Jill. Oh, Jill loves to win. Good job. Number 4 is Ashley and Danica. So I want you to know I have put down in your Canvas all sorts of the Kahoots that we've done this class, the whole semester. I've put every exam review there, and you will notice I have put the HESI PowerPoint review there that Professor Okorafor and Professor Morris will do. I'm doing the Kahoots, they are doing the other. So you have everything in one place. So you can go and look and you can study. Remember to study your NCLEX book too. They're saying those little captions, those little, tables on the side, there were some questions that were coming from them. So it is a good thing to go back and review. Can I help anybody with anything? Thank you for being a great group. Bye. Thank you for hanging in there. Bye-bye.
Bye.
Thank you.
Is
I'll
there
miss
anything
you
we need to
all.
borrow as far as, are you holding anything